This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan reduces the urge to cough by acting on a part of the brain. It is important to read the package instructions carefully before using this product. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Follow all dosage directions to decrease the risk for serious side effects. Do not use this product to make a child sleepy, and be cautious about giving other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Expectorant DM, make sure to follow the instructions given by your doctor or pharmacist. It can be taken with or without food, and it's important to drink plenty of fluids while taking this medication to help break up mucus and clear congestion. The dosage of Expectorant DM is based on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take the drug more often than directed. If you're using the liquid form, be sure to measure the dose carefully with a special measuring device/spoon. For powder packets, empty the entire contents onto your tongue and swallow, and for capsules, swallow them whole. It's crucial to avoid improper use or abuse of this medication, as it can result in serious harm such as brain damage, seizure, or even death. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's important to inform your doctor. These symptoms may be signs of a serious medical problem, and it's important to seek medical help right away if you suspect a serious issue. Some common side effects of Expectorant DM include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, be sure to notify your doctor or pharmacist right away. It's important to remember that if your doctor has prescribed this medication for you, they have weighed the benefit to you as greater than the risk of potential side effects. Many people using this medication do not experience serious side effects. While very serious allergic reactions to this drug are rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. As always, if you have any concerns about the side effects of this medication, reach out to your doctor for medical advice. In the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before taking Expectorant DM, make sure to tell your doctor or pharmacist if you have any allergies to Guaifenesin or Dextromethorphan or any other allergies. Also, let them know about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may make you dizzy or drowsy, and alcohol or marijuana can increase these effects. So, be careful when driving or using machinery, and limit alcoholic beverages. If you are using marijuana, talk to your doctor. If you have diabetes, liver disease, or any other condition that requires you to limit sugar or alcohol, be cautious as the liquid forms of this medication may contain sugar and/or alcohol. Also, if you have phenylketonuria, PKU, or any other condition that requires you to restrict aspartame, consult your doctor or pharmacist. Before having surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed, so discuss the risks and benefits with your doctor. And it is not known if Guaifenesin or Dextromethorphan passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that can occur when taking Expectorant DM. Certain medications can change how Expectorant DM works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with expectorant DM can cause a serious and possibly fatal drug interaction. Avoid taking specific medications during treatment with expectorant DM, and most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. It's important to ask your doctor when to start or stop taking this medication. It's also important to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan, as they are available in both prescription and non-prescription products. Additionally, Guaifenesin may interfere with certain lab tests, possibly causing false results. Make sure the lab personnel and all your doctors are aware that you are using this medication. If you suspect someone has taken too much expectorant DM and they are experiencing severe symptoms like passing out or difficulty breathing, it's crucial to call for emergency help immediately. In the US, you can contact your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. Remember, if your doctor has prescribed expectorant DM for you, it's important not to share it with anyone else. Also, make sure to attend all your medical and lab appointments. If you forget to take a dose of expectorant DM, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing expectorant DM, it's important to keep it at room temperature, away from light and moisture. Make sure not to store it in the bathroom, and don't freeze the liquid forms of this medication. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. And as always, keep all medications out of reach of children and pets. When it's time to dispose of expectorant DM, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. Your pharmacist or local waste disposal company can provide guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.